Hey, it's Bearded Man Steve here. I just want to talk a little bit about my mental health timeline and how seeking help and dealing with help can be traumatic given the circumstances, especially if you're on an insurance program that doesn't let you seek the best of the best help. Um, at the beginning, I tried seeking help for it was mainly emotional stuff, but they put me on meds that I should never have been on. And when I said, "Hey, I'm having," all of a sudden I'm having these weird negative, let's say, symptoms and side effects, and they said, "No, that is impossible. It can't be the medication. It's you. Let's up the dose. Oh, let's go put you on this another prescription. Oh, let's do this and that." And that went on for a few years. Um, and they also kept telling me, a lot of doctors, especially at one facility, kept telling me, "Oh, it's impossible to diagnose mental health. The only thing we're capable of doing is treating the symptoms that we see, that it's impossible to diagnose mental health." And these were supposedly mental health professionals that's telling me that. But a little bit later, I got a DNA test done. And on that DNA test, it said what prescriptions are good for you to take, cautionary, maybe work, maybe not, and ones that's been marked red for don't take, that they're dangerous for you to take. And all those medications that they were trying to put me on at first was all red flagged as dangerous for me to take. But that is what it is, and I'm very careful on what medications I take. And the first mental health professional I saw for ADHD, she was okay. She was good overall. She wasn't great, but she treated me well and she did understand the basics of ADHD at least. And then all of a sudden, her and probably like 6, 7 other doctors, including their lead doctor, left within a couple weeks. Tells you something probably happened at that facility. And the new lead doctor was the only one that I could see for my ADHD because of the medication I'm on. And he flat out told me, no one at this facility will prescribe you ADHD medication. That I have to be on these other drugs. And I'm like, I had a DNA test done, and these drugs all have an extreme negative effect on me. And the DNA test is red flagged those drugs, saying I should never take those drugs. And his exact words was to me, "You're not welcome here unless you're on these drugs." And I'm like, "Well, I can't take those drugs, so I guess I'm not welcome here." He goes, "Yeah, then you're not welcomed here. Don't ever come back here again." And I do get flashbacks about that. And I get flashbacks from a lot of things doctors and therapists have done to me. But I did see a doctor who felt bad for me one time, who diagnosed my eventually. And he's like, "Okay, we know you have ADHD, but there's something else wrong with you. We really want to look it up." And he figured out, wait, you have ADHD? Yep. He figured that out. This was like maybe a 3 hour thing, asking a ton of questions about different things that's happened, about so many different things. Weird tests. It was about 3 hours long. And then he came back and said, yeah, it's confirmed. You definitely have ADHD. That doctor was right. That diagnosed you with ADHD. But you also have CPTSD, PTSD, and rejection sensitivity dysphoria. And after that, there was some relief because at least now I have a diagnosis and I know what's going on. But still, getting fair treatment has been a nightmare. Literal nightmare to get fair treatment. I see multiple doctors, and many of them would say, "Oh, rejection sensitivity dysphoria, RSD, does not exist. That's not a real thing. Or complex post-traumatic stress disorder is not a real thing. And I've had a few doctors tell me adult ADHD is untreatable, that you should not be taking medication for adult ADHD. I've had many doctors tell me, oh, you shouldn't be on ADHD medication. No adult should. And immediately stop my medication, says you stop taking it immediately, and not realizing the harm that does. But I never had side symptoms of like I'm addicted to it, like when somebody's addicted to a medication. I never had those signs. The only thing I wanted was the relief, that help that medication does to make me feel better, make me do things better, make me easier to focus, make me easier to do things, easier to do tasks. That I really liked, but I never had withdrawals and everything else like if I was truly addicted to my medication. I'm not going to say how many doctors I've seen, but let's just say it's been more than 20. Maybe 5 of them were, and I'm not counting the one that really diagnosed me. 5 of them was okay and acceptable doctors. The rest was either talking to nothing or harmful. Therapists, the same thing. I've had 4 good ones who was willing to learn, which was good. I was grateful. Don't get me wrong. If they're willing to learn, they're willing to learn. And I love a therapist that's willing to learn, because they'll be able to help more patients if they're willing. I had one good one who was already trained in CPTSD and rejection sensitivity dysphoria. Even my first visit, she wanted to confirm those diagnoses, and within 20 minutes, she's like, diagnosis is dead on. And I'm like, yeah, I know. I just wish I could see people that who knew it like you. But she moved on to other things, and I had to stop seeing her. But seeing mental health professionals can be traumatic if they don't know how to treat patients. If they don't know how to treat ADHD, if they don't know how to treat trauma, they don't know how to treat CPTSD, if they don't know how to treat PTSD, if they don't know how to treat any of the types of PTSD, if they don't know how to treat rejection sensitivity, they're harming patients. They are literally harming patients. And the problem is these doctors don't know what they don't know. They think they know how to treat ADHD. They think they know how to treat PTSD, when in fact they don't know. And since they don't know, they think they're doing a great job. They're doing a good job. And literally, they're traumatizing clients. They are forcing clients to drugs. They are forcing clients to alcohol, because the clients are getting such a bad experience. They're being pushed to those things. They're being pushed to be homeless because these doctors don't know how to treat clients like that. Because they're what I call universal doctors who treat, you look at their specialty list of everything they treat, and it's got everything on it. Well, how can you treat ADHD? How can you specialize in ADHD and every other type of mental disorder? And have you seen the DSM-5s? They're thick. Plus the things that's not in the DSM-5. There is impossible for a doctor to know every single mental health disorder. Then why are all these doctors treating every single mental health disorder? It's a joke. And the only thing these jokes are doing is harming clients. I hope this helps you.